everyone, my name is Charmidale Blanco, a student nurse from BSN1 11D, and today I am going to demonstrate a parenteral drug administration, including the intradermal, subcutaneous, and intramuscular injection. So, parenteral refers to the path by which medication comes in contact with the body. Parenteral medication enters the body by injection through the tissue and circulatory system. Injected medications are absorbed more quickly than oral and are used with patients who are nauseated, vomiting, restricted from taking oral fluids, or unable to swallow. So now we're going to do the preparation of the medications. Parenteral medication are supplied in sterile vials, ampules, and prefilled syringes. So the equipment that we have here are the syringes. So these syringes are already with needle. So the vials. So the ampule, the sterile gauze swab, of course the sterile gloves, of course some cotton balls, alcohol, surgical tape, of course the hypodermic tray, medication cards, and of course the pens and the patient's sheet. So first is the syringe. So this is our syringe. So syringe is a sterile single-use device. Syringes come in various sizes from 0.5 ml to 60 ml. So most syringes have a lower lock. So because syringes vary and our increments of measurement vary, it is important to know how to read the syringe correctly. So when preparing injections, the nurse should select a syringe close to the volume to be injected. So next is the needles. So the needles here are already attached to our syringe. So these are made of stainless steel. So they are sterile, disposable, and they come in various lengths and sizes. So the needle is made up of the hub, shaft, and the bevel. So next is the ampules. So this is the example of an ampule. So it is very small. So these are glass containers in 1 ml to 10 ml in sizes that hold a single dose of medication in liquid form. So they are made of glass and have a scored neck to indicate where to break the ampule. So because there is a risk of being cut by the glass, so when opening a glass ampule, so the nurse should use an ampule breaker, or we need to wrap an alcohol swab package around the neck of the ampule for protection. So now in preparing medication, so of course we need to do hand hygiene. So in ampule, so we need to tap the upper portion of the ampule to move the liquid down to its neck. So we're going to tap it. So next we're going to place a gauze pad around the neck. Okay. Then we need to snap away the neck with the use of our hands. And finally, we can now withdraw the medication using the syringe placed on a flat surface. So since this is a 1 ml ampule, so we're going to use the 1 ml solo shot syringe. Okay. Okay, and now we're going to place it on the medicine tray with the corresponding medication card. So now is the vial. So vial is a single or multi-dose plastic container with a rubber seal top covered by a metal or a plastic cap. So a single-use vial must be discarded after one use, and a multi-dose vial must be labeled with the date it was opened. So this is the examples of vials. So unlike on the ampule, we can just easily withdraw the medication from the vial after opening its cap. So for example, like this. So I'm going to use the 3 ml disposable syringe with needle. So after opening the cap at the top, so we can just easily withdraw the medication. So this is a sterile water for injection. This is for parenteral. So after that, we can just insert it into the vial and withdraw the ordered amount of medication. And don't forget to put back the cap again. And then put it on the medicine tray and with the corresponding medication card. So the first parenteral route is the intradermal injection. So it is superficial injection of a substance into the dermis, which is located between the epidermis and the hypodermis. Intradermal injections are not the preferred route for administration for injection and therefore used for certain therapies only, such as tuberculosis tests and allergy tests. So we need to check the doctor's order on the patient's chart. So this is done to identify the patient's instances of harm from medical histories. So prior to performing the procedure, we need to introduce ourselves and verify the client's identity using the agency protocol. Also, we need to explain the procedure to the client and how she can participate during the procedure. So explaining the procedure of the assessment demonstrates respect for the client and allows the client to be informed of the assessment process. So, hi ma'am, I am Charmdale Blanco. So I am going to be your student nurse for today. So, can you please state your full name?
May Cordivilla.
So, your birthday?
June 7, 2000.
So, now ma'am, I am going to administer your medication through intradermal injection. So, I will be going to inject your medication only at the outer part of your skin. So, do you have any question?
No.
So also we need to perform hand hygiene and observe appropriate infection prevention procedures. This is to deter the spread of microorganisms and also to protect ourselves and our client from cross-contamination. So now we're going to arrange the medication card on the hypodermic tray with the corresponding drug. So it is already arranged. So this is to save time and effort before the assessment. So now we're going to choose an injection site free of lesion and discoloration. So we need to select the site 3 to 4 finger widths below the antecubital space and 1 hand above the wrist. So can I have your hand, ma'am? So now we're going to position the patient's arm so that his elbow and forearm are supported in a flat surface. So now we're going to apply clean gloves, use an antiseptic swab to clean the site, beginning at the center in a circular motion outward about 2 inches or 5 centimeters. So, okay, after that, we need to remove the cup and hold the syringe between the thumb and the forefinger of your dominant hand with the bevel of the needle pointing up. So, now we need to stretch the skin tone at the injection site by pulling gently with the thumb and and forefinger of our non-dominant hand. So we need to pull the needle very close to the patient's skin. We need to insert it slowly at 5 to 15-degree angle until you feel the resistance. Advance the needle up to the epidermis about 1/8 inches or 3 millimeters. So, okay, now we need to slowly inject the medication and feel the resistance until you see a bleb that resembles a mosquito bite will appear on the patient's skin. Okay, so after that, now we can withdraw the needle at the same angle, and it was inserted and pat dry cotton ball and do not massage the area. So okay, so after that, we need to encircle the wheel with blue or black pen and instruct the patient not to rub the wheel or erase the mark. Okay, ma'am, so please refrain from rubbing it and erasing it, okay? Okay, so after that, we need to assist the client to a comfortable position and indicate the site and due time for reading. So we don't need to recap and the used needle and discard needle and syringe to appropriate receptacle, wash hands and document the procedure and interpret the result after 30 minutes. So now, the next parenteral medication route is the subcutaneous injection. It is used to inject a drug into the tissue layer between the skin and the muscle. Medication given this way is usually absorbed more slowly than if injected into a vein, sometimes over a period of 24 hours. Now we're going to check the doctor's order on the patient's chart. This is done to identify the patient's instances of harm from medical histories. Okay, so now prior to performing the procedure, we need to introduce ourselves and verify the client's identity using the agency protocol. We also need to explain the procedure to the client and how she can participate during the procedure. Explaining the procedure of the assessment demonstrates respect for the patient and allows the patient to be informed of the assessment process. Okay, so now ma'am, I am Charmide Blanco, so I am going to be your student nurse for today. So please state your full name,
Danica Shines Vidal,
your birth date please.
May 29, 1974.
Now ma'am, I am going to administer your medication through subcutaneous injection. So I will be inserting it between the skin and your muscle. So do you have any question?
None.
Okay. So also we need to perform hand hygiene and observe appropriate infection prevention procedure. This is to deter the spread of microorganisms and also to protect ourselves and our client from cross-contamination. So of course, we have already arranged the medication card on the hypodermic tray with the corresponding drug. This is to save time and effort before the assessment. So we also need to determine which site we're going to use. So we need to shift the patient's clothes to expose only the potential injection site. So we need to inspect the area for bruising, inflammation, and edema. So now we need to palpate the skin and avoid any area that is tender. We need to make sure that we have the right size needle. We're going to use our thumb and forefinger to grasp a skin fold of tissue, and at the injection site, we need to measure the fold from top to bottom and check to ensure that the needle is about half as long. So now we're going to place the patient in a comfortable position and ask the patient to relax the area we're going to inject. So ma'am, please just relax your arm, okay? So now we're going to apply clean gloves. So we need to clean the site with an antiseptic swab in a circular motion starting from the center outward. So now we need to remove the needle cup by pulling it straight off and hold the syringe between the thumb and forefinger of your dominant hand as you are holding a dart. So now we need to insert the needle quickly and firmly at 45 to 90 degree angle, and we need to release the pinched skin and rest your non-dominant hand on the patient. So we're going to move our dominant hand at the end of the plunger and slowly inject the medication over several seconds. We need to retain our grasp on the syringe to keep it still. So we need to quickly withdraw the needle and place a swab or gauze pad on the site and apply gentle pressure but don't massage. So now we're going to place the patient in a comfortable position and document the procedure. We need to record the time and amount of the drugs on the medical sheet. So for the last parenteral medication route is the intramuscular injection. So it is used to deliver a medication deep into the muscles. This allows the medication to be absorbed into the bloodstream quickly. So first, we need to check the doctor's order on the patient's chart. This is done to identify the patient's instances of harm from medical histories. So prior to performing the procedure, we need to introduce ourselves and verify the client's identity using the agency protocol. Also, we need to explain the procedure to the client and how she can participate during the procedure. So explaining the procedure of the assessment demonstrates respect for the patient and allows the patient to be informed of the assessment process. So, hello ma'am, so I am Charmdale Blanco, so I am going to be your student nurse for today. So, can you please state your full name?
Giselle Cargente,
So, your birthday, please?
September 6, 2001.
Okay, so now ma'am, I am going to administer your medication through intramuscular injection. So I will be inserting it deep into your muscle, into the muscle layer of your skin. So do you have any question?
None.
So now we need to perform hand hygiene and observe appropriate infection prevention procedures. This is to deter the spread of microorganisms and also protect ourselves and our client from cross-contamination. So of course, we already arranged the medication card on the hypodermic tray with the corresponding drug. This is to save time and effort before the assessment. So now we need to select an appropriate site for the injection. So valgus lateralis and deltoid muscle are possible site for intramuscular injection. So and also we need to examine the integrity and amount of the patient's muscle mass and palpate the muscle area of tenderness are not suitable for injection site. Also, we need to inspect the area for bruising, inflammation, and edema. So if the skin shows bruises or inflammation, we need to use another site. So can I have your arms, ma'am? So now we're going to help the patient find the comfortable position that will accommodate the injection site we've chosen. So we need to expose only the portion of the body or the injection site. So now we're going to apply clean gloves and use anatomical landmarks to find the site again. So now we're going to hold the goose pad between the third and fourth fingers of our non-dominant hand. And also we need to remove the cap by pulling it straight off, and hold the syringe with the thumb and forefinger of your dominant hand as you are holding a dart. So we're going to place our ulnar side of our non-dominant hand just below the injection site and pull the patient's skin laterally about 1 to 1.5 inches. So we're going to hold the position until you inserted the needle. So now we're going to aspirate the syringe by pulling back the plunger with our dominant hand, and if blood appears, you're not in the muscles. Now we're going to remove it and discard the needle and syringe and start over. But if there's no blood, so we can proceed. So now we're going to inject the medication slowly at the rate of 1 ml at 10 seconds. So we're going to wait for 10 seconds and smoothly withdraw the needle. Also, after that, we need to release the skin and place a gauze pad on the side and apply gentle pressure, but don't massage the area. Okay, so after that, we need to place the patient in a comfortable position and document the procedure.